Hey, I'm Jeannette, one of the nurse practitioners here at Ozark Regional Vein and Artery Center. Today we're going to talk about the venous evaluation that you're about to have. So today's appointment consists of an ultrasound and then an office visit where one of the other providers or myself will come in and discuss our findings. We are looking for venous reflux today. We'll do that with ultrasound, looking at deep veins and superficial veins. First, your deep veins are going to be examined, which those are the important veins. We want to make sure that they're healthy before we do anything else. Then we'll stand you up if you're able to. Stand up and we'll look at superficial veins. The whole purpose of this appointment is, again, looking for venous reflux, which means backwards flow of blood. Leg veins have one job: bring blood back up. So whenever those valves stop working, blood can actually go down, thanks to gravity. All that blood and pressure goes backwards, and it causes a number of different symptoms. So when the provider comes in and we start talking about the different procedure options, there's four main ones: radiofrequency ablation, Varithena, Phlebectomy, and Sclerotherapy. So radiofrequency ablation is where we use heat to basically close down this vessel. You're here for about an hour for the procedure. We numb you before we do the heat. There is one incision, and it's so small we don't have to suture it. The actual procedure itself is maybe 15, 20 minutes of that hour that you're here. Very simple. You're laying down, you're awake the whole time. Get your compression stockings on, and then you can walk to the car. Varithena is an injection. So this is a chemical that's injected into the vein. One or two needle sticks, typically, very quick. The appointment's about 30 minutes. Actual time that they're working on you, probably 15 minutes or so. Again, compression stockings, walk to the car. Phlebectomy. So this is probably the weirdest one that we do, but this is pulling out those big bulgy veins. That appointment takes about an hour. Depending on how tedious everything is, it can go a little bit longer. But we make little incisions, like 3 to 4 millimeter incisions. They don't even have to be sutured afterward. This one is just weird because you feel some pressure and you feel some pulling. Again, we're going to numb you so that you don't feel pain. And then sclerotherapy. So this is, again, another injection. Similar to Varithena, just kind of a weaker version of the chemical that's injected in. We do this on like the little vessels. Usually this one gives you kind of some of the visual improvement that you're hoping for. Now, all of those procedures typically done on different days, unfortunately. But they're usually done back to back because once you start wearing the compression stockings, we want to get you out of them as fast as possible. Now, on any of the procedures, if you're nervous, we have nitrous oxide. So that's like the laughing gas. You can choose to use it. Insurance does not cover the cost of it, but it's available for any of the procedure days. Because all of our procedures, you are awake, you are able to walk to the car, we don't put you to sleep. So those compression stockings are important. We want you to be wearing them after procedure so that you don't get a blood clot, but also healing process goes much better. And we don't want these veins that we've just treated to open right back up. So they serve an important purpose, but they are uncomfortable. They are hard to get off and on. You will hate them, but just remember they're important. After a procedure, we also want you to maintain activity. We want you to be up. We want you active. We want you moving as much as possible so that you don't get a blood clot. And also healing will be a lot smoother. You'll be less bruised, less tender for as long. So activity is important, but we don't want you to do any strenuous activity or heavy lifting. So greater than 20 pounds or strenuous activity like running, squats, anything that's going to increase the pressure that you put on your legs. Walking, standing, stairs, even riding a bike on a flat surface is perfectly fine. Actually encouraged. After a procedure, you will have some bruising, will be sore, but nothing too bad day of. Few days to a few weeks later, you may notice some tender, lumpy areas. These are normal. and they will go away with time, but they can be scary. If you Google the right words, it will say that you have a blood clot. Please call us if you have any concerns, though. But tender, lumpy, red, warm areas are normal after treatment. Hope you learned a lot on this video and answer some questions before they come in and do your scan. One of us will be in to talk about everything, but if you have more questions following your appointment, please go to the website, or this video is on YouTube. You can watch it there.